It's World Autism Day on 2nd of April. Here are a few terms that you may want to avoid when referring to someone who has autism as their diagnosis. Here are some of the terms that you may prefer to ask and even confirm with them that is it okay if I use these terms in, not as labels, but just referring to you. Happy World Autism Day. If you're wondering what autism is, do check out the small slideshow that we've presented from Mindwellness. Here are some movies that I recommend that you should check out to know more about autism. Someone as young as 2.5 with autism spectrum disorder, and their parents had some very insightful things to ask. It was the parents' timely intervention. They had done their due diligence when they found the first symptoms of autism in their child, and they came up very early on for diagnosis. So luckily we were able to look at this child, and he has now, since the last 4 years, been under my care, and without any medication he does manage to do a lot of things than compared to somebody who may not have received the diagnosis early on. We enrolled him in therapy early on, his parents were made aware, and there's just so much that can be done if we can diagnose early on. Awareness is all that it begins with, and I do hope that the world becomes a more encompassing place, and more pediatricians, more general physicians, and more individuals like you and I can talk about disorders, autism spectrum, and pick out the symptoms early on for better diagnosis.